Hello, Randy St. John from Spine Physical Therapy. Today we wanted to demonstrate for you two tests that we use for the core muscles, one for strength and one for timing. First of all, for strength, we have the patient in the supine position, and laying here relaxed, we ask them to quickly lift one leg just a few inches off the bed. That is enough force through psoas generated on the lumbar spine that it should cause the core to contract firmly enough that there be no bulging of the abdomen. Ryan is demonstrating for us what you'll see in a patient with a weak core, the abdomen bulging quite a bit. Now obviously in a well-conditioned athlete, the tone of the oblique muscles and rectus abdominis may be significant enough that there'll be minimal change here, but any bulging whatsoever, even slightly, means that there is a little bit of weakness to the core. Secondly, we use marching from this position to test the timing, make sure that the core is firing quick enough. And what you'll see if the patient's timing is off is that as they lift the right leg, the left side of the pelvis tilts up towards the ceiling, and vice versa, left leg, right side of the pelvis. So this rocking back and forth. When transverse abdominis is firing quick enough, there's no motion here whatsoever. Now again, with a well-conditioned athlete versus our average patient, this will be less obvious than what Ryan is demonstrating here today. But any motion at all on the opposite side in an upward direction means there is a timing discrepancy, which simply means that the core muscles are not firing quick enough to give the patient or the athlete a stable base in the lumbar spine and pelvis in which to move around. Lastly, I'd like to cover a misconception that's out there regarding the core, where many people think that just doing core exercises will bring their core back. Unfortunately, that's not true. If the core is dysfunctional, the patient has to learn first how to contract those core muscles in isolation while not moving, get used to what that feels like, and be able to sustain that contraction while they do first simple and gradually more and more complex core exercises. We also ask our patients, once they learn how to contract this, that they try to use it functionally. It takes a lot of repetition to break an old bad habit, so they need to be trying to use their core muscles throughout their day whenever they're moving in order to change that bad habit back to proper firing and holding of the core muscles. Thank you.